Hello, my name is Minette. My hope in sharing this video is to help further awareness of the dangers of benzodiazepines and the utter carelessness of the prescribing methods used by physicians today. I'm afraid that benzos are a class of drugs that are quickly becoming a dangerous epidemic in our country, not unlike the recent opioid and ongoing opioid epidemic. I'm also afraid I'm not the only psychiatric survivor with this story. In March 2011, I went through benzodiazepine withdrawals, specifically Ativan, for possibly the third time. The first two times had not been noticed by medical professionals, although I was under their care the whole time. This is not an easy subject, but here goes. I was born and raised in the beautiful Texas Hill Country. I am now a proud homeowner in Washington State. My husband and I moved away from Texas in 2011 in August because we felt we would die if we didn't find alternative help to the mental health care system there in the state of Texas. We had both been misdiagnosed and mistreated to an extreme, medicated to an extreme. This led to loss of jobs and poverty and disability status, and we could not find physicians to listen to our concerns. I feel the need to let you know here that I was never a drug seeker. In fact, I was just the opposite, really. I was a smart kid. I graduated from my high school as valedictorian in 2001 and tested out of a year of college, maintained a 4.0 my first year in college, and I had some unresolved PTSD issues, though, and was uncertain where to find help. So my decision to drop out of school for a while resulted in severe depression. In 2002, at age 19, I was hospitalized for the first time due to suicidal ideation. Psychiatric hospitals are very pushy with the medications, and being locked up in a strange place with sometimes with cloudy slits for windows and migraine-inducing fluorescent lighting with some interesting and sometimes frightening people did not help my anxiety. So up until that point, I had been resisting psychiatric medications because the antidepressant I was prescribed at age 17 had turned me into a zombie. And in the hospital, I didn't have a choice. If I refused the medications prescribed to me, I was under threat of more days inpatient due to non-compliance. Because my very sanity was in question, there was no way to fight this, and I was discharged from there after a month with a diagnosis of bipolar on a few different brand new medications, feeling far more unstable than when I had been admitted. That particular diagnosis of bipolar is so far from the truth, it's frightening, and it's stuck with me for 10 years. It's followed me, and trust me, I'm not. 2 weeks after my first discharge, I was readmitted to a different psychiatric hospital, Laurel Ridge in San Antonio, and headed by a psychiatrist whose favorite treatment option was to prescribe 6 to 10 different psychoactive substances at a time, and when those didn't work, to pull her patients off of them cold turkey and start over with others. Needless to say, her method of treatment did not work, and I ended up hospitalized over 20 times in 2 years because I was still suicidal at the time and mental health options were limited. My family didn't know where else to send me but back to the hospital. I made it a point never to take Ativan on the outside, but hospitals pass it out like candy, and doctors and nurses coerce you if you try to refuse. And a script of at least 90 was sent home with me each time I was discharged. So, in an attempt to kill myself, I had OD'd on benzos along with my other medications more than once. I used Ativan in a suicide attempt at least twice, and I'm thinking Klonopin was in there once. And looking back, I'm certain I went through withdrawals more than one time before 2011. In fact, benzodiazepines of any kind should never have been prescribed to me again after my first attempt. So anyway, at my request, my psychiatrist on the outside and I had an agreement that she was never to prescribe any benzos to me. I had noticed a deep craving for them while inpatient at one point, and I didn't know I'd already been through withdrawals, though, as none of my doctors recognized withdrawals as a part of pharmaceutical use, not just part of street drugs. And they attributed my symptoms and my psychosis to the diagnosis that they had given me, not, a reaction or a withdrawal from their medications. This is a shame. Anyway, I was in talk therapy at the time, and it was working for a long time. I had not been hospitalized and therefore had not even touched Ativan for over 3 years. But in 2011, some medication changes put me back inpatient, this time in the Methodist system, again in San Antonio, and the psychiatrist on the unit at that time refused to listen to me. I was prescribed Ativan, among other things, of course, yet again. I spent those 5 days inpatient talking to doctors, nurses, social workers, anyone who would give me the time of day, and begging them to look into my symptoms. I had become violent and homicidal, and I had never experienced that before. I knew my feelings were caused by a drug, but I didn't think it was the Ativan. I didn't think it was the Ativan. It didn't cross my mind. I thought it might be the newly prescribed drug that, I had never taken before. But no one listened anyway. And 5 days later, I was released, discharged into the caring arms of my husband. Maybe my insurance wasn't so great. Maybe they didn't know what else to do with me. More than likely, the beds were full and they needed to make room for patients who were in even worse condition. So this was the first time I'd been released from a hospital for psychiatric reasons without a script for Ativan, So I'd only been on it for 5 days after not having had it for 3 years. This was on a Friday that I was discharged, and by Saturday evening I was hallucinating. By Sunday I was in the grips of full-blown withdrawals. My senses were screaming. Any sort of noise was excruciating. I began a week of chills, convulsions, rage, hypersensitivity, claustrophobia, hallucinations, neuropathic pain, and itch. I refused medical care because it was the hospital that put me where I was, in the condition I was in. And my outside psychiatrist attempted to get me back on the Ativan in order to taper, but that just extended the symptoms and made the craving worse. So she prescribed Neurontin after that, and that ended up inducing MS-like symptoms, multiple sclerosis type symptoms. I lost my ability to walk. I gained a stutter when I spoke, and both of those still surface at times 5 years later. I didn't sleep more than 30 minutes a day for a very long time. There was no filter between my thoughts and my mouth. I did not stop talking, and it took me over a year to really gain that back. I was insane. in every sense of the word, and it was hell. My brain was convinced I was dying in it. It started shutting down my body systems, and peristaltic action came to a grinding halt by the end of March. I had to see a doctor because my bowels had not moved in 1 month. I was advised not to lift anything for fear of tearing a bowel. I lost 40 pounds in 2 months. That's not healthy. On the heart, it's just not healthy. I'm lucky I didn't have a major stroke. I'm lucky I have a patient husband. I'm lucky I have family who is willing to relieve him so he could sleep, go grocery shopping, do anything but watch me. I'm lucky to have had good neighbors who wisely ignored me screaming and flailing in my front yard because I couldn't stand the walls of my rental home closing in on me. I'm lucky to have had good landlords who worked with us as we struggled financially. They brought us dinner when we were late with rent while I was going through the withdrawals. And I'm lucky to have survived it all. But it's taken until this year that I feel any semblance of the calm, reasonable person I felt I was before the withdrawals. I still hallucinate during stressful times. The intensity has steadily decreased, and I have a stutter I never had before at times. Neuropathy has lingered as well, but I found that proper diet, regular exercise have helped me to decrease those painful episodes. My anxiety is through the roof, but I'm learning to manage. I'm in talk therapy again and haven't taken psych meds of any kind in 4 years now, and what do you know? I also haven't been hospitalized in 4 years. I attribute regaining my ability, that's a record for me, by the way. I attribute regaining my ability to read, to work, and to learn new coping techniques to ditching those medications. Hasn't been easy. I don't expect it ever to be easy. I still struggle with rage, depression, anxiety. I'm very angry that I had to go through this. I was never a seeker. This was worse than heroin withdrawals. I'm very angry that my suffering was because other doctors and other professionals refused to listen. I'm angry at the decade that I lost my 20s to the psychiatric system in Texas. I'm very angry that I had no recourse against the damages done to my brain and body by those, by this stupid label and this record of crazy. I'm very angry that this record follows me and affects my treatment by medical professionals for even physical ailments. I'm also very angry the Texas Medical Board was of no help at all. And 2 of the worst psychiatrists I have ever met are still in practice today. And they have records too. They have records of overdrugging, records of inappropriate actions toward patients, but they have never lost their licenses. And this really makes me rage, but my rage is why I write, why I speak, why I'm making this video. And today finds me working on my bachelor's degree to become a patient advocate. My dream is to speak to doctors and lawmakers all over the country if I can, and I want to brainstorm better ways of dealing with mental illness than high doses of medication, labels, and shock treatments. Yes, ECT was included in my treatment and was extremely damaging to my ability to function. And yes, I am recovering from that as well, but that's a story for another day. I want to change the system, and it's going to take some time. Whole lot of time, maybe far beyond my lifespan. I don't know, but if by speaking it out in this one video I can spare just one person from the hell I've been through with benzodiazepines, I feel I've made a worthwhile mark. And I thank you for listening.